Hi, today let's talk about the remedy belladonna. You have heard that belladonna is mainly used in acute conditions. The main theme in belladonna is that it is violent, intense, it appears suddenly, and it resolves suddenly. The common name for belladonna is deadly nightshade. It's also called Atropa belladonna. So the main affinity of this remedy is to the nerve centers. So the cluster of neurons that are specialized for special functions like respiration, thermoregulation, speech and auditory, etc. And also it has got affinity to blood vessels and capillaries. It has affinity to the right side, especially in head symptoms, and right to left or left to right in other symptoms. It has got affinity to the mucous membranes of eyes, mouth, and especially the throat. Now let's come to worsening and better. So what makes it to modality? So what makes it better and worse? So worsening, it has got hyperesthesia, meaning that it is very sensitive, oversensitive to stimuli like light, movement, noise. Jar is very specific for belladonna. So a belladonna patient will say if they are lying in bed, they will not allow you to sit even near their bedside. So the slightest jar really irritates them. So jar, motion, noise, and also it we can see that if they have a haircut, it can cause symptoms like they have a cold suddenly after a haircut, or if exposed to drafts of air, cold air, I mean. And then if after 3 p.m. and after midnight, their symptoms are really worse. They usually intensely desire huge quantities of cold water. They might also desire lemon and lemonades in fever. And they are better for rest and for staying still. Either they stand still or sit still or lie down. Although it is worse for touch and pressure, it is better for continued pressure. So if they have applied a band-aid or a cap, they feel better. So those are the main modalities we can see. So regarding the symptom pictures, so the thread of symptoms that lines through is that it is intense, it is hot, it is burning, it is red and inflamed. So if they have a headache, it is oppressive, tensive, and they will say that it feels like my brain is moving to and fro. They want it just still. So that is a type of headache, and the headache is mainly on the right crown of the head. And the headache and the colic is better for bending backward. So those are the special things to note about it. And then regarding the eyes, the pupils are dilated and shiny. So in Renaissance period, the Italian women used to put drops of belladonna into their eyes to make them look more attractive and alluring. So that's how it gets the name Belladonna, beautiful lady. And then the pains to the ear or throat are very piercing, intense, tearing, stinging. And the throat symptoms. So the pain in the throat is very intense. It burns, and the tonsils might be red and inflamed. And they will have pain, especially in the parotid gland area, which is a largest salivary gland just beneath and in front of the ear. It might be swollen too, and they say that it is intensely painful. So when they can, it's very painful to swallow even liquids for them. And the fever modality. So when they have fever, it's not just locally there is heat, but subjectively the patient will say that it's burning hot. That's how the patient will verbalize, because it's just so hot. And then in fever, as I say, it is not just that fever will gradually rise. In belladonna fever, it will increase violently. It will be intense. So there would be night fevers where it'll just shoot up, then it'll slowly come down again. So there will be remittent fever. Also, the mental symptoms are very violent in fever. So they will have hallucinations, delirium. The patient will hit, strike, kick, get very angry, very irritated. And if their eyes are inflamed, they will itch, especially in the inner canthus of the eye. So that is also a modality there. So the main thing to remember in belladonna is it is violent, intense. It comes on suddenly, goes away suddenly. So the patient is better today. The patient has just gone out, just got wet in the rain or had a cold draft on them. They come back and they just have got a high temperature. They have sudden cold. And if they have coryza, it'll be very fluent, very watery, mostly from one nostril. So the symptoms are so intense. That's the main thing that you should remember. And it burns and it's inflamed. Hope this was useful. Have a lovely day. See you again. Until then, stay healthy, be happy. Take care. Bye.